Do you ever eat a lot of food quickly, even when you're not hungry, and then feel sad or guilty afterward? If yes, you might be experiencing signs of binge eating disorder, or BED. Unlike just overeating at a party, BED is when this happens often, with a feeling of no control. Imagine finishing a whole pizza alone in one sitting, not because you're starving, but because you can't stop, even when your stomach hurts. It's not about willpower. It's a real mental health condition that affects millions. People with BED often feel shame and hide their eating, making it hard to ask for help. What leads someone to develop binge eating disorder? It's not just about food or being weak. Think of it like a puzzle with many pieces. One piece could be biology. Maybe your brain chemicals, like serotonin, aren't sending the right stop eating signals. Another might be your genes. If a family member struggles with eating or weight, you might be more at risk. Then there are emotions. Stress, sadness, or even boredom can trigger overeating. For example, after a tough day at work, instead of calling a friend, you might open 3 bags of chips without realizing why. Trauma, dieting too much, or being teased about weight can also add to the risk. How do you know if it's BED and not just regular overeating? Here's a simple test. In the past month, have you eaten a large amount of food in a short time, like 2 hours, and felt unable to stop or control what you're eating? Do this more than once a week. If yes, it might be BED. Other signs include eating fast, eating until uncomfortably full, eating alone due to embarrassment, and feeling guilty or disgusted later. For example, Sarah eats an entire cake after her kids go to bed. She doesn't want it, but feels she can't stop. She hides wrappers in the trash. These patterns repeat weekly. That's not laziness, it's a symptom. No blood test can detect BED, but doctors use conversations to diagnose it. They might ask, how often do you feel out of control when eating? Or, do you eat even when full? To meet the formal diagnosis, this must happen at least once a week for 3 months. Treatment, it's hopeful. Therapy, especially CBT, cognitive behavioral therapy, helps people understand triggers and build better habits. For example, instead of eating when stressed, you learn to walk or text a friend. Support groups can also help. You're not alone. In some cases, doctors may recommend medication to manage urges, but therapy is the main tool for lasting change. Can BED be prevented? Yes, especially with early help. Think of it like learning to drive. Practice makes better, not perfect. Teaching kids to eat when hungry, stop when full, and cope with emotions without food helps. For example, instead of saying finish your plate, ask are you still hungry? Also, avoid strict diets. Yes, they often backfire and lead to binging. Building self-respect, body acceptance, and healthy routines reduces risk. If you notice someone hiding food or eating fast, talk kindly. I care about you, want to chat. That simple step can prevent years of pain. Scientists are learning more every. Recent studies show that certain brain patterns in people with BED react strongly to food images, like an alarm going off. New treatments like GLP-1 drugs, used for diabetes and weight, are being tested to reduce binge episodes. Also, apps with mood and eating trackers help people notice patterns, like I binge every Sunday night after being alone all day. AI tools are even offering real-time support. One 2023 study found that online CBT programs work nearly as well as in-person ones, making help